About a third of women will experience pelvic pain at some point during their lifetime. For one metro area mother of two, the pain set in and wouldn't let up.
She spent nearly 3 years trying to figure out what triggered the dull ache in her lower back. It was a little-known condition that's common in both women and men. The Fox Medical Team's Beth Galvin is here to explain. Beth?
And Deidre and Tom, the culprit in this case was varicose veins, but they weren't in your legs where you typically hear about them, but in your pelvic area. The symptoms can be confused with a lot of other conditions, and this condition is especially hard to diagnose in women.
It took Gina DeBras nearly 3 years, 10 MRIs, and dozens of doctor's office visits to find interventional radiologist Dr. Jason Levy at Northside Hospital, who finally helped her understand what was causing her pain.
I started to think it might just be all in my head. Maybe it's just me.
Gina says the pain began after she had given birth to her 2 children.
I just started to notice a lot of pressure in my pelvic area, back pain down to my thighs. And so I thought, it's my back.
She went to a pain specialist, a neurologist, a rheumatologist, and 2 neurosurgeons, but nothing she tried stopped the pain.
I feel like I was labeled as, oh, she's got pain. She's that pain patient. And it just really started to make me feel depressed. And I thought, okay, well, maybe I'm just going to have to spend the rest of my life like this.
Gina finally found Dr. Levy after a radiologist noted on one of her MRIs that she had swelling in the blood vessels in her pelvic area. She was diagnosed with something known as pelvic venous congestion syndrome.
They're broken veins. They're veins that don't work. They're varicose veins, just like the more commonly known varicose veins of the legs. They're varicose veins of the ovaries. It's a challenging diagnosis, and many women suffer from going from doctor to doctor or possible treatment to possible treatment.
Because the main symptoms can be confusing: chronic pelvic pain and a feeling of fullness in the pelvic area.
But it typically presents with pain that is worse when they're upright and improves after a long night's sleep when they're lying down. But the pain can be really debilitating. Just yesterday I saw a patient who said, I couldn't work for a week because of the pain.
Gina underwent a minimally invasive catheter procedure called an embolization. Dr. Levy went in and plugged the leaking veins in her pelvis, and pretty quickly the pain went away.
You have to be your own advocate these days in healthcare. And if you have a hunch of something that you may think is wrong, then you need to be empowered to go and search for it.
And this embolization procedure that Gina underwent is typically an outpatient procedure that's performed usually under local anesthesia with an IV sedation. And it has a pretty high success rate, reducing or eliminating chronic pelvic pain in about 20% of women who undergo the treatment. So Tom and Deidre, you're talking about this long journey to try to get relief, but fortunately she did find an effective treatment for her.
And something common among men as well as women, you said.
Absolutely. More difficult because for women, their organs are buried more deeply in the abdomen, so the problem is hard to visualize with women, but common in men too.
Thank you, Beth.
Thanks, Beth.